Over the last 60 years, the United States moved away from large institutions for people with disabilities and mental illness. The promise was simple: community-based care, dignity, and integration. But for families dealing with autism, PTSD, severe mental illness, and complex medical needs, it often doesn't feel like freedom. It feels like the system is scattered everywhere. And the harder your situation is to explain, the harder it is to find help. In the early 20th century, people with developmental disabilities and mental illness were often placed in large, state-run institutions. Many of those facilities were overcrowded, underfunded, and harmful. By the 1960s, public pressure and policy reform began changing that. The Kennedy administration pushed toward community mental health services. Then in 1999, the Supreme Court decided Olmstead versus LC, holding that people with disabilities have the right to receive services in the most integrated setting appropriate. That sounds like progress. And in many ways, it was. But it didn't solve the whole problem. The institutions didn't just disappear. They were replaced by fragmented systems. Instead of one building, there are multiple disconnected programs. Instead of one process, there are eligibility rules, wait lists, and separate agencies. Instead of guaranteed support, families often have to fight to qualify. And fragmentation doesn't just slow things down, it hides responsibility. Now think about this for a second. Someone with autism, PTSD, diabetes, and serious behavioral or medical needs. One system handles developmental disabilities. Another handles mental health. Another handles medical care. But no single system is fully responsible for the whole person. So the only place everything comes together is the family. In Florida, developmental disability services are handled by the Agency for Persons with Disabilities. One of the main tools is the iBudget waiver. It can cover residential support, behavioral services, personal care, and some medical-related needs. But access is not simple. In many cases, families wait years before receiving full support. Priority depends on crisis level, and the system does not automatically coordinate every need. So even when the law says community care, families still have to navigate multiple systems that don't work together. This is where families get stuck. You're told services exist, but no one explains how they connect. No one shows you where to start. And if your situation is complex, you can be too much for one system and not enough for another. The system didn't fail overnight. It evolved this way, through decades of policy decisions. And understanding that history is the first step to understanding what families are dealing with today. In the next episode, we're not just explaining the system, we're showing how to actually move through it. If this helped you understand the system a little more clearly, please like, share, and subscribe. And if you know someone trying to navigate this, send this to them. Because the more people understand how this works, the harder it becomes for it to stay invisible.